So deep, question for you. How do you get the fox eye lift?
So the fox eye lift is a really popular aesthetic treatment. So when you follow the golden ratio, one of the things that make an aesthetically beautiful face, especially for a woman, or the feminine look, is the 12 to 14 degree angle of the lateral canthus. So in order to achieve that, there's several things you need to do. We inject the temporal fossa using the Dr. Swift 1/1 technique. This is one injection that's injected into the 1 centimeter quadrant of safety here. The filler will then naturally hydrodissect down to any areas of cavity and help to expand that temporal fossa, helping to lift the brow a little, and also, even if you're lucky, lift the cheek. So that's the temporal injection. Then you can do zygomatic arch. So by pulling the cheek up, you're also tightening the skin here and giving that a lift. So this is all indirect. Then you can go directly with filler onto the lateral canthus of the eyes. Now, I see a lot of people trying to do this with cannula, but it's not effective. An advanced injector will know how to do this. So we will lift the actual lateral canthus of the eye, and that will improve the competency of that lower eyelid and improve the axis to a more positive tilt, and hopefully to that 12 to 14 degrees. Now, what we want to do after that is we've used filler, we've gone indirectly, then we've gone directly. Now we're gonna get help by using toxins. So we'll inject orbicularis oculi. We'll then make the muscles above work even harder. We'll then help to pull the eye up. Filler on the temporal fossa, which is helping to lift from here. The zygoma, which is helping to lift here. Directly the lateral canthus, which is helping to lift. And then you've also got toxins that are helping by strengthening this muscle, by paralyzing the muscles more inferior. And if you're going to be really pedantic and you think to yourself, do you know what, I want an even bigger lift, then you can use HIGU, where we will use 2 millimeter of ultrasound energy to then lift up the eyelid, and that helps to also rotate the eye up. So we're really going in with ultrasound, hyaluronic acid, and a toxin. And then lastly, you can also do PDO threads. So you do a thread down here and then across here, and then that will help to lift the eye. So that is how I would get the perfect lateral canthus lift, or the fox eye.
Perfect, very informative, thank you.